YourMed is a smart medication management solution that's designed to help people stay independent, and it works anywhere in the world without actually working in far-flung places, which we'll discuss in a moment. YourMed has received a number of awards in the past couple of years, and one we're particularly proud of is the EU-backed Cease to Grow Award, which rated YourMed as one of the top 5 technology companies in Northern Europe over the last 5 years. And delighted to say we're receiving that award later today. On our banner slide, you'll see a mugshot of my colleagues. One of my colleagues decided it was a good idea to take a picture during lockdown of the team. And I always say to people, it looks more like a most wanted photo than anything else. But suffice it to say that that's how things have to work in lockdown, I guess. What I want to go through today are 5 main points. The first is a bit about us, which hopefully will give you a flavour of what we do and how we do it. Then I want to go through to the problem that we solve and why, and following on from that, what is our solution, what evidence do we have, and finally, how you can contact us if you're interested in working with us. We are a healthcare technology company that understands a number of key aspects of our value chain. We understand care homes. This is where we started when we rolled out some services back in 2013. And we now support about 7% of the market there in software solutions, where over 80% of our customer base is rated good or excellent according to CQC for their services in meds management. We work very closely with the pharmacy sector. We have over 50 pharmacy groups as valued customers, and we understand the vital role they play in the healthcare fulfillment channel, for example, as you've seen with COVID rollout at the moment. And a lot of them have inputted into the delivery of our smart products. We work now in Europe. We work in Holland, in Spain, in Belgium, and further afield like Australia. And put simply, we solve problems, working closely with our clients, rather than, as I say, shifting boxes. We're passionate that technology should be for everyone, and we mean everyone. And that's why we put together, right at the beginning, a technology manifesto. What we say is that whatever we design, it has to be extremely simple at the point of use. And it increases in complexity the further we go away from the user, so that our monitoring systems are quite complex indeed, but the user doesn't have to be bothered with any of that. We believe passionately in 3 things. That first, that everyone is included. Second, that everyone can access it. And third, that everyone can use it. So our mantra, if you like, is include, access, and use. So moving on then to the problem. What is the problem that we try and solve? Put simply, over 5 million people in the UK currently take 3 or more medications a day. 70% of all people in council care are on medication, and some surveys suggest even more than 70%. So 70% of 1.2 million is quite a large number indeed. And many of those in council care have only the council teams and support to support them, i.e. monitoring centres. So they have very little care outside of their immediate council supporters. We know that better adherence means that patients have a better health outcome. And we also know that those who manage their health better remain independent for longer. So putting the 2 together, we can say that the better the outcomes, the lower the long-term costs. In other words, YourMed is a strategic tool, both short-term and long-term, to reduce care costs in the councils, in the NHS, and the private pay market. So what is YourMed? When you look at this box, you'll see the numbers and the electronic device. This really is our technology manifesto in action. All the user has to do is to hear the alarm that generates from the electronic device, look at the number that appears on the screen, and open the advent calendar door. So it's easy to use and it's easy to understand. One of the reasons I think that we've been successful is that the look and feel of our product is very familiar. There are almost 2 million non-smart ones dispensed in the UK every week. We believe passionately that pharmacists should be working and filling medication, not individuals or family members. And so the pharmacy fills the packs, checks when the medication rounds are due, and delivers the product fully charged in full working order. It works off SIM technology, therefore there is no need for Wi-Fi or broadband. Again, we're focused on inclusion. And finally, your meds accessible to the support net. Each member of the support network is linked to that user via an app, in both the Google App Play Store and in the App Store for iPhones. Unusually, for products of this type, we're actually a Class 1 medical device. And we're also an ISO 27001 accredited company, so that our customers and our clients can be assured that our data is secure. Our solution is also being vetted and analysed by Lloyd's in London, which is the world's largest insurance company. And again, another first for us is that they've actually insured our technology for use within the community. So carers not insured to administer medication can actually do so with our system. The pack and the app, which you can see here on the left is the pack, the app on the right, fire data into a central dashboard or portal, which can be assessed by care staff, monitoring centres and so on in real time. What that dashboard does is it provides a detailed picture of how the user is doing and a very detailed audit trail for every medication round that user should be taking. By working to such level of granularity and detail, we can basically identify problems early and help carers to address them quickly. In terms of supporters, we allow up to 5 supporters to be identified by the user. So here we empower the user to take control back of their medication regime. The app is locked to a specific user, and the app only tells people what they need to know through a simple traffic light system. So again, going back to our manifesto, it's easy to use and easy to understand. By getting family members to support users, we find that we create what we call free social capital. In other words, counsellors can pass on the complexity of supporting a user to their family and therefore saving themselves time and costs, which then allow the council to bring more people into the safety net. Crucially, we create capacity in a very tight capacity constrained market. A little bit more detail about how the support system works. Again, true to our philosophy, we only tell people what they need to know. So each person is given a number so they know that when they've been contacted, the person before them has failed in their duty. So they know their pecking order. We don't inform everybody at the same time, which improves efficacy and also retains people's interest in supporting an individual. And the telecare provider can provide an overview of what's going on. At Your Meds, we're all about data, but not data for the sake of it. We're all about actionable data. The data we gather has an immediate output. It informs people as to what to do. For example, we know when a user has taken their medication, if the medication was taken too late or too early, if medication has been missed, or if they've tried to access multiple rounds of medication at the same time. The data we collect can be used proactively, as in the case, for example, of West Lothian Council, who use it as a weekly cognitive assessment tool on their service users. Also, our notification process is fully customizable, which again makes Your Meds unique. Analyzing the data helps to build up a profile of the user and allows effective interventions, we'd like to say, to take place. Knowing whether service users are taking their medication is especially an important component of artificial intelligence or algorithms that aim to predict user behavior. For example, the probability of a fall next week, or whether they're going to have an episode in the next 24 hours. If we didn't know whether the medication was being taken, much of this input into the algorithm would perhaps not be so effective. So we welcome partnerships, and we operate an open API system to integrate our data with these platforms. Where does Your Meds work? We work in reablement, hospital discharge, mental health, and we support people to become more independent if they have, for example, learning difficulties. So what's the evidence? Well, I've selected 3 councils to show you some data. I apologise if the data is difficult to see, but the scales are the same on each one, 0 to 100, 20 to 100. The data on the left is for Manchester City Council, which shows adherence from the beginning of September 2019 to last week. So well over 13 months of data during a very difficult period for social care in which to operate, numerous lockdowns and tiered restrictions. In Manchester, we're now well over 70% adherence, having been in the 50 to 60% range in the middle of the year. And for West Lothian, we're consistently high. We're now averaging over 80%. Just to give an example of some of our international work and the disparity of differences we can see of adherence across countries, this is our work in Holland, where we started back in February, just as lockdown hit the UK. And the data here is insanely strong, partly driven, I think, by a small but rapidly growing population set, but also by a very strong participation from pharmacists who have worked very closely with their customers. And the same is true also when you look at human factor studies that the EU did for us, for example, in Belgium, with over 75% acceptance rate of the product. Overall, across our sample of people using Your Meds, we're achieving 85% adherence over the past 4 weeks in lockdown, and we feel that that number is sustainable. The ROI data, the return on investment data, reinforces the West Lothian case study that they published in December, where they showed a savings rate of 9 times on their investment. This data, by the way, the savings does not include gains made to health, where we have as yet to formally evaluate our benefits. I'm personally quite proud of this chart. It shows that we've supported over 30,000 medication rounds for just these 3 customers, and every one of which has been taken in their own homes and on their own without any support. Putting this into context, many of these medication rounds would have required a visit by either a carer or council staff. Almost 4 in 5 of over 30,000 med rounds have been taken correctly, and our users include those living with dementia, with Parkinson's, with mental health, learning difficulties, and so on. So we're not talking about what I would call straightforward cases. And it also reinforces our fundamental proposition that better adherence leads to improved user outcomes, and improved outcomes leads to lower care costs, better targeted care, and reduced demand in primary and secondary services. What I would say at this point is just don't take our word for it. Here are some quotes from a West Lothian case study for an elderly male user, age 93, who was diagnosed with vascular dementia. Not only is this a vulnerable and shielding person whose family members were forced to stop visiting because of COVID, but Your Meds gave them the necessary peace of mind that all has been well. Your Meds provide something, in my personal view, that simply cannot be valued. And finally, a second case study, a much younger male, 49 years old, with serious learning difficulties. And in this case, it's instructive because it took a few weeks for the user to get familiar with our product, but once familiar, became very independent, and adherence rates went up over 80%. So I'd like to thank you all for listening. I thank you for your time, and hope we would love to have a meeting with you to discuss how Your Meds can support you. My colleague Priti Patel and I are happy to answer any questions you may have. Thanks, Terence.